communicable diseases include a range of chronic health conditions such as sickle cell, cancer, to name but a few. Most times, they lead to disabilities. In this episode, we discuss such conditions and the interventions by the government and other stakeholders. Welcome to the premier disability show in Kenya. My name is Jane Theuri.
Differently abled, differently.
The Ministry of Health is seeking to reduce the burden of sickle cell disease in the country through Sickle Cell Afya Dhabiti project. Take a look at how the launch went.
Sickle cell disease has affected countless lives in the country and beyond, causing pain and suffering.
In the places where sickle cell disease is a high burden disease, like Kenya, it is estimated that 15 to 20% of all the infant mortality could be attributed to sickle cell disease. So even as we put all the efforts trying to reduce our infant mortality, if we do not pay due attention to sickle cell disease, we'll never be able to achieve the figures that we need. Most of the deaths that are recorded as having been due to pneumonia, as having been due to malaria, as having been due to sepsis, in these high burden areas, if you look at the underlying condition, it is actually sickle cell disease.
They go through a lot of physical symptoms, one of them being pain. Pain is really severe in sickle cell. That pain can completely reduce your quality of life to zero. You can't eat, you can't sit on the table with your family, you can't talk, you can't go to school, you can't go to work.
We do get attacks which is called crisis, which are painful episodes where blood has stuck in the veins at some area, mostly in joints. So yeah, we do struggle a lot with that, and we find that in such a situation you do need quick medical intervention in order to have a chance of getting treatment. But they do fight a lot of battles, not only physically but also mentally. So we would love such a program to include maybe a package to deal with the mental health of some of these warriors, because out there it's a very cruel world, and if you're not strong enough to survive it, people do give up a lot.
Those who have sickle cell disease now will be able to access treatment, and they should not suffer. They should not really spend a lot of money in accessing the services that will be provided. That is in line with the government agenda of universal health coverage. Generally the government does not want people to suffer financial hardship as they access health care.
We would also like that we have some data capturing tools so that we are able to give exact specific figures. We are not able to adequately report on sickle cell, so we may not actually be able to say what is the exact burden of the disease, but I know this is could be work in progress, but we pray at the implementation level that if we could get registers and reporting tools and platforms for that, we can be able to capture proper data.
We are aware that access to medicine remains a challenge for sickle cell disease patients in low-income countries. We therefore would like to collaborate on increasing access, as well as investing in research for new treatment options to address unmet medical needs.
The Ministry of Health, together with other partners, launched the Afya Dhabiti project in a bid to ease the burden of sickle cell disease in the country.
As we gather here to launch the Sickle Cell Afya Dhabiti project, a partnership in advancing sickle cell care in Kenya. This project represents a crucial step forward in our collective mission to address the challenges faced by individuals and families affected by sickle cell disease in our country. And indeed, it is a step forward and well aligned with the call of universal health coverage that the ministry is undertaking. The ministry is looking at making sure no one is left behind in the spirit of universal health coverage. That spirit of leaving no one behind includes that you will not miss healthcare that you need because you cannot afford. So ability to pay should not be the criteria for you to get the healthcare you need. So I'm happy that this program is actually focusing on those issues of reducing mortality, morbidity in terms of people who are usually very sick or need medications, or even the number of deaths from sickle cell. We have a project that we call the Pen Plus project that we are piloting in 2 counties, Vihiga and Isiolo. We have actually helped them. We started by training healthcare workers, and we are training them on NCDs, one of them being sickle cell, also type 1 diabetes and rheumatic heart disease, but many other diseases as well, how to take care of these patients at the lower level of care.
Society is diverse in very many aspects, including financial aspects, but UHC is protection against catastrophic spending. And the protection of catastrophic spending needs to be looked in terms of the diversity. So we have the people living in informal settlements, and we want to also safeguard the people who are currently paying out of pocket by providing affordable services so that they might not run into the issue of catastrophic spending. So with this, the health sector is really looking towards investing in health system strengthening so that we may protect the 42% also. For it is this 42% that provide for the 58% that is living in the informal settlements.
To the warriors, our years of work are making dividends. I remember when we didn't have a sickle cell day in Kenya. Today we gather and we celebrate once a year. We didn't have it. I remember how many times we knocked on the door of the Ministry of Health. Today we are called for the meetings. This never happened.
Comprehensive screening programs across the country to identify individuals at risk and early detection will help in managing the disease effectively.
Apart from those 2 medications that I've said, the next important thing that has been shown to make a very big difference is early diagnosis. And we are grateful that the Ministry of Health recently came up with a policy on early infant screening, because when you diagnose early and you start the interventions early, then you get better outcomes. But it is not useful to screen when you don't have the interventions in place.
The project also seeks to lower the cost of hydroxyurea, the essential medicine for sickle cell disease, hence alleviating the financial burden. We acknowledge that a lot more discussion needs to happen in this area, and we commit that we'll make sure that this happens and we are able to make sure that the essential medicine that is really needed for treatment of sickle cell is actually available to Kenyans as and when they need it. We would like to see people access treatment as much as possible. The majority of them die before they reach the age of 5. I think for many years, being a public health doctor as well, we always focused on trying to reduce the mortality of children under the age of 5. And we have succeeded in many other fields. We've been able to get vaccines in this country. We are vaccinating our children. We are having less deaths, but we can't have a vaccine for sickle cell. And it's very sad that a child is not allowed to live their life to become a full adult, a parent, a professional, a grandparent, that our children are dying when we can actually protect them and maybe prolong their life with a good quality of life. We are committed to enhance the capacity of our healthcare providers across Kenya to diagnose the condition promptly and provide treatment according to our national guidelines. By investing in training, and we will ensure that more individuals receive a timely diagnosis and appropriate care. We aim to transform the landscape of sickle cell in Kenya. The objective is to raise awareness, and it's also imperative that we challenge the level of knowledge of our populations. We have to make sure that they know what a sickle cell disease is. If you have sickle cell, then what do you need to do, among the other information that our population needs to be aware of. Through educational campaigns, use of community health promoters, and sickle cell champions, we will empower the community with accurate information to enhance screening and foster understanding and empathy. Early diagnosis and appropriate treatment are cornerstone of effective sickle cell care.
Today's event, therefore, marks another milestone in our 4-year journey that has seen Novartis tackle the challenges of sickle cell disease in Africa. Ladies and gentlemen, as Mahatma Gandhi once said, the future depends on what we do in the present. We are excited, and indeed very excited, to join forces with the Ministry of Health and local partners in Kenya to re-image, treatment, and care for people with sickle cell disease.
Apart from the medical intervention, the resilience and strength of individuals with sickle cell disease is appreciated in the implementation of this project.
Kindly, let's not forget about the negative sides that we've been facing, because if we cannot acknowledge where we went wrong, then we'll not be able to correct our path and do the best for the future. Thank you for the consideration and for the plans that you're making for the future. I believe that's something worth fighting for.
We are also looking to make sure that it is not because of the type of the disease you have. So no one should be left behind because they have the certain type of diseases. As we are focusing on the double burden of diseases that is affecting our country, that is both the infectious diseases and non-communicable diseases, we've looked at various non-communicable diseases based on lifestyles. We also looked at the ones that are due to genetic and rare diseases like sickle cell diseases. And we are putting in place measures to be able to make sure that all the variety of diseases that are affecting our people are actually addressed.
And living with the condition hasn't been easy, but day by day we try to manage it. And the initiative that has been launched today actually is going to help many of us, me included, because now the medication will be much available and hospital admissions will be bearable through costing, and also the insurance that they're trying to launch will benefit us, because now when we go to hospital we won't struggle as much like before. It will also be pocket friendly to us, and I'm sure we're going to be happy as sicklers.
As Minister of Health, we are going to provide the oversight during the implementation of the project. We will prioritize sickle cell disease as key unmet need in the Kenya health agenda.
I am a mother who has had 2 sickle cell warriors. My son passed away at the age of 30. So everything you've said here resonates with me, not just as a physician, but as a caregiver. And I have a daughter who's living positively with sickle cell. And my daughter is a pharmacist looking into drug development and design, so inspired by the condition that many like her face on a day-to-day basis. And so when I speak, I bridge medicine and public health with the reality of the lives of the warriors and their caregivers, and in particular, the mothers who are the primary caregivers of the warriors. And so today I want to speak about championing the voices of the sickle, the voices of the warriors, the voices that have brought us here together. I do this because these are the voices that are always unheard. You've heard them speak to you today to ask to bring them to the table. We're doing that much better now. But I want to assure us that when we come together, greater things will happen.
And for a person with sickle disease, then it is very important for them to be aware of potential challenges, what they actually need, advocate for it, to prevent the crisis so that they have the quality of life they actually deserve.
We now take a short breather, but we'll be right back with more. Don't go too far.
Differently abled, differently.